Hey, it's Dr. Mandell, and I want to start today with a very simple question. How many of you out there spend 2, 3, maybe even 4 or more hours a day sitting in your recliner chair? Go ahead, raise your hand, because I know it's a lot of you. And honestly, I completely understand why. You've worked hard your whole life. You've raised families, built careers, taken care of everyone around you. And now, when you finally get to sit down and relax at the end of the day, that recliner feels like heaven. It's your chair, your place, your reward. And I'm not here to take that away from you. But here's what I am going to tell you, and I need you to really listen to this. Because that chair that you love so much, it may be silently and steadily destroying your lower back. And most people have absolutely no idea it's happening. Today, I'm going to explain exactly why this is happening, using real anatomy, real science. And then I'm going to show you what you can do about it. Because you can keep your recliner, you just need to use it smarter. So stay with me all the way through this video because the exercises and tips I'll share toward the end can genuinely change how you feel every single day. Let's get into it. To understand the problem, we first need to talk about your spine, because your spine is an incredible, beautifully engineered structure. When you're standing upright in good health, your spine has a natural S-shaped curve. You have a gentle inward curve at your neck, a slight outward curve in your mid-back, and then another inward curve in your lower back. That lower curve is called your lumbar lordosis, and it is absolutely essential for keeping you pain-free. This S-curve is not an accident. It's designed to act like a shock absorber. It distributes your body weight evenly across your vertebrae, keeps your discs cushioned, and allows your muscles and ligaments to work in perfect balance. Now, what happens when you sit down in a recliner and lean back? Think about it. Your hips fold up toward your chest. Your lower back gets pushed backward. That natural inward curve in your lumbar spine, that beautiful lordotic curve, gets flattened out. Sometimes it even reverses. And when that happens, everything changes. The pressure on your lumbar discs, specifically the discs at the L4, L5, and L5-S1 levels, which are the most common areas for back problems, that pressure gets redistributed in ways your spine was never designed to handle for long periods of time. But it gets worse. When you're lying back in that fully reclined position, your core muscles, your deep, stabilizing muscles, they shut off. They don't need to work because the chair is doing everything for them. And the longer this happens, day after day, the weaker those core muscles become. Think of it like an arm in a cast. The moment you stop using a muscle, it starts to atrophy. And when your core is weak, your lower back has to work even harder just to keep you upright when you finally stand up. That's when the pain hits. And there's one more piece to this puzzle, your hip flexors. When you sit in a recliner for a long time with your knees slightly elevated, your hip flexor muscles, the muscles that connect your spine to your thighs, they stay in a shortened, contracted position. Over time, they tighten up. And tight hip flexors pull directly on your lower lumbar vertebrae. They pull your pelvis forward, increase the compressive load on your lower back, and contribute to that deep, nagging ache that so many of you experience. And let's not forget your head. When you're reclined and watching TV, most people end up with their chin jutting forward and their head pushing into the headrest. That forward head posture puts tremendous strain on the cervical spine, your neck. And that tension travels all the way down into your upper and lower back. Now, why does this hit people over 60 so much harder than younger adults? Three reasons. First, your intervertebral discs naturally lose water content as you age. They become thinner, less spongy, and far less able to absorb and redistribute pressure. So even a small amount of abnormal loading causes much more damage than it would in a 20-year-old. Second, after the age of 60, there's a natural process called sarcopenia, the gradual loss of muscle mass and strength. Your muscles can no longer compensate and protect the spine the way they once did. Every bit of core weakness matters more now than it ever did before. And third, your ligaments, the connective tissue that holds your vertebrae together, they lose flexibility and elasticity over time. This means your spine is less resilient, less forgiving of poor posture, and damage accumulates much faster. The bottom line? The recliner that feels so comfortable is often working directly against your body's natural design. And the older we get, the more we feel it. Now I want you to think about your own daily experience, because a lot of people come to me with lower back pain, and when I ask them about their habits, the recliner conversation almost always comes up. Here are some of the most common warning signs I want you to watch for. Number 1, morning stiffness in a chair, not in a bed. You sit down in your recliner to watch the evening news. An hour or two later, when you go to stand up, your lower back is stiff, tight, almost locked up. It takes you several minutes before you can walk normally again. That right there, that post-sitting stiffness, is a classic sign that your lumbar spine was under abnormal stress while you were in that chair. Number 2, back pain that gets worse after resting. This one surprises a lot of people. Most folks assume that rest makes things better. But if your back pain peaks after sitting in the recliner, not after physical activity, that's a significant red flag. It means the chair, not your activity level, is the culprit. Number 3, pain that radiates down into your buttocks or thighs. If you're feeling aching, tingling, or a shooting sensation down one or both legs after sitting in your recliner, that tells me your lumbar nerve roots are being irritated. This can be the early stages of sciatica, and it needs your attention. Number 4, sleeping in the recliner regularly. A lot of people with sleep issues or acid reflux end up sleeping in their recliner. I understand why. Sometimes it genuinely helps certain conditions. But for your spine, it's a disaster. Your body needs to be in a flat, supported position during sleep, so your discs can rehydrate and decompress. Consistently sleeping in a recliner denies your spine that recovery time. And number 5, an overall feeling of your back being rigid and stiff after just an hour of sitting. Not painful necessarily, just stuck. Like your back aged 10 years while you were watching one TV show. If any of these sound familiar to you, and I think a lot of you are nodding right now, this video is for you, and I promise we're going to fix this together. All right, now I want to walk you through the 5 biggest recliner mistakes I see, because knowing what not to do is just as important as knowing what to do. Mistake number 1, sitting in the same position for too long. This is probably the most common mistake of all. I don't care how ergonomic your chair is. The human body was not designed to stay in any single position for extended periods. When you stay perfectly still for an hour or more, the fluid dynamics inside your spinal discs change, your muscles disengage, and circulation decreases. You need to be moving, shifting, adjusting, at minimum every 20 to 30 minutes. Mistake number 2, reclining too far back. Here's something counterintuitive. Most people think the more reclined they are, the more relaxed their back is. But research consistently shows that a very low reclining angle, what I'd call the almost flat position, around 135 to 150 degrees, is actually one of the worst positions for your lumbar discs. The sweet spot is much closer to upright than most people use. Mistake number 3, no lumbar support. Look at most recliners, especially older ones, and you'll notice the lower back area is either flat or slightly bowed outward. There's nothing filling in that space at your lumbar curve. So your lower back is essentially floating in midair with no support. Every minute you spend like that, the muscles in your lower back are working overtime to hold you up, and eventually they fatigue and spasm. Mistake number 4, using the recliner as your bed. I touched on this already, but it's worth repeating. Sleeping in a recliner every single night is a serious problem for your spine, and I see this a lot in my patients over 60. They drift off watching TV and just stay there all night. If this is you, we need to talk about solutions, because your back is paying the price. Mistake number 5, standing up the wrong way. How many of you just whomp, push the footrest down, and brace yourself up in one quick motion? That sudden extension of your spine from a fully reclined position, especially first thing in the morning or after a long sit, that is one of the most common ways people trigger acute back injuries. The discs and ligaments need time to adjust. We'll cover the right way to stand up in just a minute. Okay, now we get to the good stuff. Because here's my philosophy. I don't believe in telling patients to simply stop doing something they love. I believe in teaching them to do it better. So let's talk about how to use your recliner in a way that actually supports your back instead of destroying it. First, find the ideal reclining angle. Research on seated spinal mechanics, including the landmark work of Dr. Wasim Amir Bashir on lumbar disc positioning, consistently points to the 100 to 110 degree range as the safest zone for your lower back. That means slightly reclined from fully upright, but nowhere near flat. You should still feel like you're sitting, not lying. Your spine should maintain a gentle curve, not be forced flat. Try adjusting your chair to that position tonight and notice the difference. Second, add lumbar support. This is simple and inexpensive, and it makes an enormous difference. Get a small lumbar support pillow. You can find them online for $10 to $20, and place it in the curve of your lower back, right above your belt line. You're filling in that gap between your back and the chair, allowing your spine to maintain its natural lordotic curve even while relaxed. Your hips should ideally sit at a height where your knees are at the same level as, or just slightly lower than, your hips. This takes stress off the hip flexors. Third, follow what I call the recliner movement rules. Every 20 minutes, make a small position change. Shift your weight, adjust your arms, tilt your pelvis slightly. Just break the static hold. Every 40 minutes, stand up. Walk to the kitchen and back. Get a glass of water. Check the mailbox. Your discs need movement to stay hydrated and healthy. Movement is literally what pumps nutrients into them. Every 2 hours of recliner time, do a set of gentle stretches. I'll show you those in just a moment. Fourth, and this is critical, learn how to stand up properly. Before you get up, bring your chair back to the fully upright position. Don't try to stand from the reclined position. Then, slide yourself forward to the edge of the seat. Place both feet flat on the floor, about shoulder width apart. Put your hands on the armrests, and now lean your upper body slightly forward as you push through your legs and your arms to rise. Nice and slow. No sudden jerking motion. Give yourself a moment to stabilize when you're fully up before you start walking. This simple adjustment alone can prevent a tremendous amount of acute back injury. Now for my favorite part, because this is where you take back control. These exercises are designed specifically to counteract what the recliner does to your body. And the great news is, most of them are gentle, safe, and can be done right here, some even while you're still in the chair. Let's start with what you can do while still seated. Exercise 1. The pelvic tilt. Sitting upright in your chair, gently draw your belly button in toward your spine, like you're bracing for a light tap on the stomach. Hold that contraction for 5 seconds, then release. That's 1 rep. Do 10 of these. This simple movement re-engages your core muscles that have gone quiet in the recliner. It's gentle enough for anyone, and it's incredibly effective. Exercise 2. Knee to chest stretch. From your seated position, reach down and gently pull one knee up toward your chest. Hold it there for 20 seconds, feeling a gentle stretch in your lower back and glute. Then switch to the other side. Do 2 rounds on each side. This stretch decompresses the lumbar spine and relieves the compression that builds up during prolonged sitting. Exercise 3. Ankle pumps. While seated, simply flex your feet up toward your shins, then point them down. Up and down, up and down. 15 to 20 repetitions. This keeps blood circulating in your lower legs and prevents the pooling that can happen during long sitting sessions. It's especially important for anyone who tends toward leg swelling or blood clots. Now, let's move to what you do after you've stood up. Exercise 4. Standing cat-cow. Face the side of your recliner and lightly rest your hands on the armrest for balance. Now, gently arch your lower back, sticking your tailbone out, letting your belly drop, and hold for 3 seconds. Then round your back the other way, tucking your pelvis under, rounding through the lumbar spine, and hold for 3 seconds. Alternate back and forth 10 times. This mobilizes the entire lumbar spine and is one of the best movements you can do after sitting for any extended period. Exercise 5. Hip flexor stretch. Step 1 foot back behind you into a slight split stance. Keep your back leg fairly straight and gently bend your front knee while keeping your torso upright. You should feel a stretching sensation at the very front of your hip on the back leg side. Hold for 20 to 30 seconds. Then switch legs. This is critical because those hip flexors have been shortened and contracted the entire time you were in the recliner. Releasing them takes direct pressure off your lower lumbar vertebrae. Exercise 6. Standing glute squeeze. Simply stand upright, feet shoulder-width apart, and squeeze your glutes, your buttock muscles, as firmly as you comfortably can. Hold for 5 seconds. Release. Do 10 repetitions. This sounds almost too simple, but it's incredibly important. The glutes are supposed to be the primary stabilizers of your pelvis and lower back. After prolonged sitting, they go almost completely inactive. Waking them back up is one of the most valuable things you can do for your lumbar spine. Now, Here are 3 exercises I want you to incorporate into your daily routine, not just after the recliner, but as part of your regular movement practice, because these exercises will build the strength that protects your back over the long term. Daily Exercise 1. The Bird Dog. Get onto your hands and knees on the floor. Use a yoga mat or a folded blanket for comfort on your knees. From that tabletop position, slowly extend your right arm out in front of you while simultaneously extending your left leg straight behind you. Hold for 3 to 5 seconds. Bring both limbs back to center. Now switch. Left arm, right leg. That's 1 full rep. Aim for 10 repetitions on each side. The bird dog is one of the most research-backed exercises for lumbar stability. It strengthens your deep core muscles, specifically the multifidus and transverse abdominis, which are the primary protectors of your lower spine. Daily Exercise 2. The Glute Bridge. Lie on your back on the floor with your knees bent and feet flat. Press your feet into the floor, engage your core, and lift your hips up toward the ceiling until your body forms a straight line from your shoulders to your knees. Squeeze your glutes at the top. Hold for 3 seconds, then slowly lower down. Do 10 to 15 repetitions. The bridge builds strength in your glutes, hamstrings, and lower back simultaneously. It is the perfect antidote to the glute weakness that comes from excessive sitting. Daily Exercise 3. The Wall Sit Stand. With your back against a wall, slowly slide down until your thighs are roughly parallel to the floor, or as low as your knees and hips comfortably allow. Hold this position for 20 to 30 seconds, then slide back up. Do 2 to 3 rounds. The wall sit builds lower body and core strength without putting any compressive load on your spine. It's safe for the knees when done correctly, and it creates the kind of functional strength you need to stand up from your recliner and every chair in your life with confidence and stability. Now, I want to take a moment to be very clear about something. Most recliner-related back pain responds beautifully to the kinds of postural adjustments and exercises I've described today. But there are situations where your symptoms are telling you something more serious, and you need to listen. Please see your doctor or a qualified healthcare provider if you experience any of the following. If your pain shoots down past your knee, into your calf, your foot, or your toes, that level of nerve involvement needs professional evaluation. If you have numbness or tingling in your legs or feet that doesn't go away after you change position and move around, please get that checked. If you notice any weakness in your legs, difficulty lifting your foot, a feeling of your knee giving way, that is not something to ignore. If your pain does not improve at all after 2 to 3 weeks of careful attention to posture, movement, and exercise, a professional assessment is warranted. And most urgently, if you ever experience a loss of bladder or bowel control, go to the emergency room immediately. That is a sign of serious spinal cord involvement and is a medical emergency. Your body is always talking to you. It whispers before it screams. Learn to listen to it early, and you'll be miles ahead. All right, my friends, let me bring this together for you. Your recliner chair is not your enemy, but the way most people use it, leaning back too far, sitting too long without moving, with no lumbar support, and standing up too fast, that combination creates a perfect storm of stress on an aging lower back. Here are the 3 things I want you to take away from today. Number 1, posture and angle matter. Keep your recliner between 100 and 110 degrees, add a lumbar pillow, and protect that natural curve in your lower back. Number 2, movement is medicine. Get up every 40 minutes, shift every 20. Don't let your body get stuck in any single position. Number 3, strengthen your core and your glutes. These are the muscles that protect your spine every single day of your life. The bird dog, the bridge, the wall sit. Do these regularly, and your lower back will thank you for years to come. You deserve to sit in your favorite chair and enjoy your relaxation. You've earned it. I just want to make sure your body feels good enough to enjoy it for many, many more years to come. If this video helped you today, please give it a thumbs up. It helps more people just like you find this information. Share it with a friend, a spouse, a family member who might be dealing with back pain. You might change someone's life. And if you haven't subscribed to Healthy Aging America yet, please do, and hit that bell notification so you don't miss a single video. I'll see you in the next one. Take care of your body. It's the only place you have to live.